Chemotherapies are an important part of cancer treatment, but we learned over decades of use in the US they have the potential to cause harm when they're not used correctly. Every healthcare worker has the right to be safe when doing their job. And chemotherapies can be used safely in any cancer treatment center, even when resources are limited. We don't have to choose between safe cancer treatment and affordable cancer treatment. We can have both. There are several low-cost interventions that cancer treatment centers can implement to ensure that their care is in line with international safety standards.
As the use of chemotherapy increases across the world, so does the risk of occupational exposure. So, one of the key components of the Chemosafe project is to bridge the shared experiences of safety planning across hospitals, countries, and different resource settings. This discourse between cancer programs creates a platform to build realistic short and long-term goals towards internationally recognized standards. Here are a few members from our community answering questions and sharing their experiences from their journey.
Safe handling of chemotherapy is important because chemotherapeutic agents are hazardous. They are classified as hazardous medicines, meaning that they have great potential to cause harm to the users, to the environment, as well as to the patients. So they need to be handled carefully. They are not like some of the simple medicines that we are familiar with.
For a lot of us who are practitioners, this is something that we drill into our students and our colleagues, as well as anybody else who comes in contact with it from day one. So for us, these are drugs which so-called cure or treat cancer, but they on their own can also pose a lot of problems to someone who doesn't, I guess, show the amount of respect that these drugs deserve.
In my own experience, I feel like the most important message to pass along to anyone who may be involved in the dispensing or the handling of hazardous agents is really to develop a firm understanding of the why behind all of these policies and procedures that are presented to them. These methods are in place to protect them, and so it's really important to reinforce that fact to each individual involved in the med use process.
All healthcare workers are potentially at risk of exposure to the hazards of these chemotherapeutic agents and other hazardous medicines or products within an institution. So when we think about safe handling of hazardous drugs, we need to think about the whole continuum of care. We need to think about the pharmacists, the nurse practitioners. We also need to think about the oncologists or the prescribers. But in addition, we need to think about the logistics staff, for example, those that receive medicines within the stores, as well as the housekeeping staff who would handle the laundry, or those that would clean the clinical areas or the store areas. We need to think about everybody in the continuum of care. So safe handling of chemotherapy agents can be improved even at no cost or at low cost to the institution when resources are limited. You don't have to have the big money for you to implement safe handling of chemotherapeutic agents.
Important actions hospital leaders can take while building an oncology program include making a priority to protect the patients and visitors and staff's health. So examples for doing that with chemotherapy could include providing education for all new staff and making it a required part of their orientation and onboarding. They can also develop programs to provide periodic updates for experienced staff as well. Furthermore, hospital leaders can provide the proper equipment and supplies for safe chemotherapy handling. One thing that we can think about is that we don't have to do it alone. So if I were to have to build all of this protocols, if I had to develop all of the equipment lists and everything else that is required by myself, I think I would be very overwhelmed. But there are resources out there that can really help. There are team members out there. There are national and international standards and references that can be referenced that can really help do a lot of the groundwork so that you don't have to do it by yourself.
You are not this alone. There are people who are in various stages of the journey. So tag on to people who have been there so that you don't have to make the same mistakes that we made.
If you'd like to learn more, visit our website, alliedagainstcancer.org. And when you're ready to get started, you can download our Chemosafe app from the App Store. The app will assist you with conducting an end-to-end assessment of your facility to identify areas in need of strengthening. The American Cancer Society is working with our partners to expand access to safe, effective cancer treatment. We have a shared vision for a world in which all healthcare workers have full protection from exposure to hazardous medicines, including comprehensive training, safe work practices, and access to personal protective equipment. This will allow them to not only protect themselves, but also their patients, caregivers, and the environment.